warahmatullah. And good morning to all respected audience. I'm Amira Hafid, a librarian from al-Hikmah Library. It is my honor and privilege to welcome you all to our online talk today, titled Emotional Roller Coaster, Ride Like a Pro and Boost Your Work Life, featuring the distinguished Dr. Mohd Faiz bin Tahir from the Department of Psychiatry and Mental Health, Kuliah of Medicine, IIUM Kuantan. Okay, before we delve into the heart of our session, let me take a moment to introduce our distinguished speaker. Okay, Assistant Professor Dr. Mohd Hafiz is currently serving as a psychiatrist at the Sultan Ahmad Shah Medical Center, SASMEC. Dr. Mohd Faiz. Okay, my apologies. Assistant Professor Dr. Mohd Faiz is currently serving as a psychiatrist at the Sultan Ahmad Shah Medical Center, SASMEC at IIUM. Okay, Dr. Faiz holds a medical degree from IIUM and completed his master's in psychiatry from University Kebangsaan Malaysia, UKM. Since 2014, Dr. Faiz has been working at IIUM as a lecturer at the Kuliah of Medicine. Okay, he has been invited as a speaker or trainer for many programs such as Mind of Care First Aid for Mental Health Training Program, organized by Petronas in partnership with the Malaysian Psychiatric Association, program pengenalan hikmat nasihat dan runding cara pegawai takbir psikologi JAIS, and kursus pemantapan pegawai pergigian yang menjalankan sesi intervensi merokok, organized by Kesihatan Pergigian Negeri Sembilan. With a wealth of experience and expertise in the field of mental health, Dr. Faiz is not only a lecturer, but also a compassionate practitioner dedicated to enhancing emotional well-being. Okay, before we move on to the next session, a gentle reminder to all respected audience members, during the session, if you have any questions, feel free to unmute yourself, or you may as well put the question in the chat box. Yeah? Okay, our committee have put the I attend in the chat box. So without further ado, I would like to invite Dr. Faiz to deliver his session. Falyatafaddal mashkura, Dr. Faiz.
Thank you, Sister Amira. Hope the audio is fine. Boleh dengar? Alhamdulillah. Clear?
Very clear, Doctor.
Alhamdulillah. Bismillahirrahmanirrahim. Alhamdulillah Rabbil Alamin. Wassalatu wassalamu ala ashrafil anbiya wal mursalin wa ala alihi wa sahbihi rasulillah ajma'in. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. Assalamualaikum warahmatullahi wabarakatuh. To Sister Amira MC for today. We also have Sister Nik Hasmahani and also Sister Shahida with us today. Alhamdulillah, keeping us company. And thank you to the library unit, department, the library department, your IIUM, for inviting me to this session, which I will be sharing on the topic which was given to me. Okay, emotional roller coaster, question mark. Ride him like a pro and boost your work life. Very interesting title, I would say. I'm just curious who came up with the title. I'm just curious. Maybe one of the staff here, I'm not sure, but it's a very interesting title. And from my point of view, it can be seen from many angles. Many angles. Bagi pendengar yang mungkin nak dengar bahasa Melayu, sila maklumkan. Yang nak dengar Inggeris, sila maklumkan. Nak dengar campuran bahasa Melayu Inggeris pun sila maklumkan. InsyaAllah, we will try to cater to all. Okay, or cater to the majority, insyaAllah. Baik. From a emotional point of view, to talk about roller coaster, then I would say that we go through it every day. Okay, we go through it every day. There are days that we are happy, there are days that we are sad, and there are days that we are somewhat angry, there are days that we are upset. And also within the day, we can be angry and sad and upset and whatever it is. Dan dalam erti kata lain, emosi ini naik turun. And of course, the emotions for most of us, it changes due to the stressors that we are faced, right? Due to the stressors that we are faced, these things will change. And sometimes we only focus on the stressors. In other words, we perhaps might tend to blame other things, okay? Other things, other people, and sometimes we fail to look within ourselves whether these emotions are coming from within, okay? As a clinician practicing psychiatry, right, especially in SASMEC and perhaps other facilities as well, mainly SASMEC, in the psychiatry and mental health department, I see a lot of patients. We see a lot of patients going through emotional changes. And as something factual, I would like to say that emotions is within all of us. Okay, semua orang beremosi. Semua orang ada emosi. Okay. Dan mungkin antara some of the limitations that I see in our community, in our culture, is that expressing emotions seems to be a topic of taboo. Maknanya nak meluahkan perasaan ini adalah satu perkara yang tidak digalakkan atau tidak dibenarkan atau tidak disukai dan sebagainya, so on so forth. Okay. Kalau what I say this is true, then silang kat tangan. Kalau boleh lah. Tak boleh tak apa. Nak express emotions. We want to express our emotions. People will say that, oh, ini tak resilient ni hati tisu ni tak kuat ni. So these are the things that I will talk about in terms of stigma, in terms of culture acceptance. Okay. So before we proceed, I would just like to give you a simple case scenario, boleh? Case scenario, so that we are, focused on one same situation. It's a bit long, okay, tapi sama-sama kita dengar. It's in English. Kalau ada rakan-rakan yang nak tolong translatekan, silakan, boleh guna chat box. Okay. Kisahnya lah, the story is about Miss S. Miss S is a dedicated librarian. Okay, tak ada Miss S kat sini. Miss S tadi bukan Syahidah, ni orang lain lah. Miss S is a dedicated librarian at a prestigious university where she oversees the management of a vast collection of academic resources. So kerja dia ni memang nak kena jaga buku-buku, resources semua ni. Her role involves assisting students, faculty and researchers in assessing information for their studies and projects. Kerja library ni tak senang punya, susah. Banyak kerja. However, Miss S finds herself on an emotional roller coaster as she navigates the demands and the complexities of a job. Jadi maknanya she has to kena menghadap kerja dia tu banyaklah demand sana, demand sini from all quarters, from all sectors. So her emotions is up and down, just like most of us. On a busy Monday morning, Miss S received multiple requests from students. Student ramai ni minta ni. And faculty member, lecturer minta semua untuk research assistance. While she enjoys helping others, the sheer volume of inquiries and deadlines to meet overwhelms her. Banyak sangat kerja sampai sekaput. She feels a mix of pressure and determination to provide quality support despite the workload. Okay, walaupun kerja banyak, dia tetap hendak menjalankan tugas. Alhamdulillah, Masya Allah, sister Miss S ni, bagus orang ni. Saya pun tak tahu dia kahwin ke belum, saya tak tahu. Okay. Cerita lain. Okay. As Miss S delves into her task, she encounters a technical issue with the library's online catalog system, causing delays in retrieving requested materials. This frustrates both Miss S and patrons waiting for resources, leading to moments of tension and dissatisfaction. Maknanya dia nak buat kerja ni, tiba-tiba sistem hang. Kan? Dia nak buat kerja, sistem hang. So kita lihat dekat sini, bukan salah dia sistem hang. Okay, tetapi pressure itu dirasai oleh Miss S dan also dirasai oleh pelanggan-pelanggan, klien-klien iaitu student dan juga lecturer. Okay, so this is the situation. Amidst these challenges, Miss S receives positive feedback from a graduate student who praises her guidance in finding rare manuscripts for a dissertation. This recognition boosts Miss S' morale and reminds her of a meaningful impact she has on academic pursuits. Okay, so maknanya dalam kekhususan ini tadi, someone is kind enough to give a positive remark on her hard work. Okay. Someone recognizes her hard work. So nanti kita reflect balik, adakah kita memberi recognition pada orang lain di tempat kerja kita. Alright? Okay, however, nak sikit lagi nak habis. Miss S emotional roller coaster continues when she faces criticism from a faculty member regarding the library's collection gaps in a specific research area. Ni ada lecturer yang fussy sikit lah kot lah. Okay. Dia Karen sikit lah kita kata. Dia nak buat macam mana? Masing-masing tertekan nak kejar KPI kan. Despite Miss S' effort to explain the acquisition process and budget constraints, the faculty member expresses frustration and disappointment. Marah betul lecturer ni, kan? Ataupun faculty member ni. Dan Miss S hadap je lah nak buat macam mana. Later in the week, hujung minggu tu, Miss S attends the professional development workshop on emotional intelligence and stress management for librarians. Pernah buat di UIA? Tak pernah, sister? Tak pernah? Tak ni. Maknanya tempat ni bukan UIA lah, cerita ni bukan di UIA. So, the session provides valuable strategies for self-care, communication, resilience, empowering Miss S to navigate her emotional roller coaster more effectively. So we see here, right, the organization gives the opportunity for Miss S to acquire all this knowledge and skill. Okay, I'll repeat that again. Self-care, communication, and resilience. At least ada tiga ni. I'll share more later. Now, reflecting on her experiences, berdasarkan pengalaman beliau, Miss S acknowledges that being a university librarian involves balancing diverse responsibilities. Dia kena membuat mencari keseimbangan dalam kerja, dalam hidup. She needs to manage expectations and dealing with both challenges and rewards. Ini kerja hari-hari lah, kerja hakiki. Through continuous learning and self-awareness, I'll repeat that again. Through continuous learning and self-awareness, Miss S strives to ride the emotional roller coaster like a pro, enhancing her work life and professional growth in the university setting. So, point dia dekat sini, continuous learning and self-awareness. Maknanya sentiasa belajar, sentiasa menimba ilmu dan juga ada muhasabah diri. Ini yang poin-poin penting yang kita nak tengok. Bagaimana kita nak, how do we want to go through an emotional roller coaster and how to ride it like a pro and how to boost our work life. Okay. I'm just going to deliver around 15-20 minutes and then I can entertain Q&A. I'm sure there'll be some burning questions and any of you who wants to share the experience, pengalaman, siapa saja yang nak kongsi pengalaman ataupun pandangan mereka, boleh guna menti.com. Okay, menti.com ni is anonymous. I wouldn't know who sent it. Okay, we cannot trace it. So you can use menti.com. But if you want to use the Zoom chat also, we will accept that as well. So no problem. Okay. So based on my small experience in psychiatry and mental health, when we talk about emotions, most people that I see sometimes do not understand what emotions are. They are not aware of their emotions. Sebagai contoh, as example, when a person talks about communicating with family members or with colleagues, and they are sometimes someone who gets angry easily, or someone who gets disappointed easily, or someone who gets sad easily. They are not able to name that emotion. They don't know that. They don't know that that is an emotion. They know that they are sad. They know that they are angry. Kan dia tahu dia sedih, dia marah. Tetapi they are unable to melihat dalam diri, to see within why are they feeling that way. And most of our work sometimes involves in naming emotions. It sounds so simple, but sometimes it helps the client a lot. Especially when clients come from backgrounds who are not exposed to things about emotion, especially clients who are young, teenagers or young adults. They don't know why they are feeling this way, why they're angry, why they flip, why they easily ticked off. So we have to explain what emotions are. So, but I'm not going to go into what emotions are today. I'm just saying we need to understand emotion. And one of the ways to understand emotion is being aware of our emotional states. We have to be aware of our emotional states. We must know throughout the working day, have we been happy? Have we been sad? Have we been disgusted? Have we been, whatever emotions that we go through? If we look at the wheel of emotion, I'm sorry I don't have any slides today. If we look at the wheel of emotions, there will be at least 30 or 40 types of emotions within. Okay, I'm just going to give you a quick example about emotions, how complex it can be. Have we seen people yang bila dia menang hadiah, when they win an award or where they win something, they cry. You know, they cry. You know, terima kasih. Saya tak sangka saya menang. So we kind of think like, you know, some people might say, kenapa nak menangis? You menang, you kenalah happy, right? But some people understand why people cry when they win something, because the emotion is so intense that they feel, you know, humbled by it. They feel a lot of things. So emotions is not just a one thing: happy, sad, disappointed, you know, disgusted. It's not that. It sometimes can be a mixture. It can be anger mixed with a bit of happiness. You know, all this concoction. You know, so it sometimes can be very complex, and we are aware that sometimes we come across people and we have we can say that, yeah, aku tak faham lah dia, I don't understand that flow lah. He's like this, he's like that. We don't understand that because sometimes we also don't understand the complexity of emotions, right? There is a word what we call as a phrase what we call as emotional intelligence. Okay, emotional intelligence. Some people might confuse it with common sense. Okay, common sense is common sense, emotional intelligence is emotional intelligence. But what I can say for today, that emotional intelligence is a soft skill. Tak semua orang ada emotional intelligence. Right? Tak semua ada emotional intelligence. So emotional intelligence is a soft skill that can be learned actually. It's not something that, you know, you're born with. You know, some people do have the ability to see other people's emotions and empathize, but some people can't, but they can learn it. They can learn it. So sometimes we do have sessions to talk about emotional intelligence so that people are aware of how to respond to others. Okay? And especially when we're working in, for myself, we're working in healthcare, you know, we need to understand emotions of our colleagues, emotions of our patients, emotions of their family members, and it's a very important skill. In fact, it's somewhat a tool to us in psychiatry. If we don't have emotional intelligence, then one of the skills that we can use is not available to us. In other words, kalau kata you, contoh a surgeon kan, you need certain tools to do certain operations. So in psychiatry, if you don't have this empathy as a tool, you don't have emotional intelligence as a tool or a skill, then some therapy or some sessions is going to be a bit hard. Okay, I'm sure some of you have met healthcare providers, whether it's from mental health background or not, yang they don't seem to be empathizing with your situation. Sebagai contoh, as for example, if you go to a clinic and then you know, you've been coughing for like a week or 2 weeks, and the healthcare provider that sees you is like, berapa hari batuk? Oh, seminggu. Oh, makan ubat. Okay. Lepas tu boleh kerja ke tak? You know, like they don't show that empathy in terms of communicating with you. So these are the things that sometimes we need to relearn or teach or share with people in healthcare especially. All right. So that's one of it, emotional intelligence. So the next one is when we talk about understanding emotions, right? The question is, does emotion impact productivity? Yeah. Does emotions impact productivity? Of course, most of you say yes, it does impact productivity. In what way? Because if I'm angry, then I cannot be optimal at work. If I'm sad, I cannot be optimal at work. You know. So what we want to know is that if we know that emotions impact productivity at work, then what are the measures that we're doing to learn about emotions, to control emotions, to ascertain that emotions are at a high, at an optimal level so that people can be productive. Okay. In other words, if you've heard about the phrase ataupun the condition what we call sebagai burnout, then you would know that it's a lot to, it has a lot to do about emotions. Okay. I do want to talk about burnout today, but I'm just going to put it at the end of the session. I think by around 10, I can talk about burnout. Studies have shown that job satisfaction is high when people recognize and understand emotions. Okay. job satisfaction, puas hati dengan kerja, suka dengan kerja. Bila emosi bagus, right, happy, satisfied, then your job satisfaction rate increase. Okay. So maknanya in other words, when we talk about emotions ni, nak kerja more happy lah. Right? Itu je. Nak kerja more happy. Tapi jangan happy sampai menyusahkan orang. Itu je. Okay. Nak happy. So kalau ada, if there are any of our departmental members or unit members who are not optimum in terms of emotions or not happy, then there must be something that has to be done at that level. Okay. There are people who kata, alah kerja memanglah macam ni. Aku dulu pun macam tu juga. Hadap je lah. Yeah. So, susah sikit lah. Ataupun some people say, alah kau ni manja sangat lah. Benda sikit pun kau nak terasa. We must know that people are built differently. Setiap orang berbeza. Tidak sama. Okay. So, some people boleh tahan panas. Some people boleh tahan sejuk. Macam aircon bilik ni, saya rasa okey lah, boleh tahan lah. Tapi untuk seorang sejuk sampai meletetang, gigil-gigil, pakai baju tutup habis. Okay. Ada seorang panas, buka aircon 18 degree Celsius pun panas juga. Nak buat macam mana? Kan? So maknanya dari segi emotions pun tak semua sama. We do not respond to the same stressor in the same manner. Kita tidak. Okay. Tapi dalam masa sama, don't get me wrong, I'm not trying to say manjakan your unit members ke apa tidak. Tak, I'm not saying that. Jangan manjakan, but try to understand what they feel and try to accommodate to that. Okay, fair enough. Okay. The other thing about emotions, kita nak sebut pasal emotional regulation techniques. I'm just going to give an overview. We talk about things seperti deep breathing exercises. Pada banyak di YouTube dia tengok. Teknik pernafasan dalam. Okay. Sedut dalam-dalam. All these kind of things. Mindfulness, the meditation. Okay. Pada saya, dalam Islam sendiri, in Islam itself, the practice that we have, promotes us to think deeply. Promotes us to be calm. Okay. Jadi kalau mana yang sembahyang tarawih itu laju sangat, pelan-pelan sikit lah. Saya tahu imam laju kadang-kadang, saya tahu. Saya tarawih boleh buat sendiri insyaAllah. Okay. Cognitive behavioral techniques. Okay. We want to understand the psyche or what people think, and we give those things that we will reframe negative thoughts. We'll try to suggest problem-solving techniques. Okay, when we challenge irrational beliefs, all these things we do with that dalam CBT. Physical activity. Most of you know that physical activity has a positive effect on mental health. Kan? Walaupun penat mendaki Bukit Pelindung, tetapi selepas itu you feel happy, you feel rasa macam puas lah. Kan? Puas. Ya. Ada yang suka mendaki bukit apa itu? Panorama. Ikutlah bukit mana nak daki pun atau nak buat sukan mana pun, you will know that the effect afterwards will be something which is positive. Okay, a lot of study shows this. And also the other one that I suggest to my clients is journaling. Journaling maknanya mencatatlah, buat log, buat buku catatan, nota, some people call it diary, whatever you want to call it. You have to journal at least your thoughts or emotions. Sebagai contoh, for example, today pukul 8 pagi wake up, hari ini I feel happy because whatever it is. Okay. At 10 p.m. I feel a bit sad because whatever it is. So you journal it. Okay. Ya betul, Sisi Zati Bukit Beru. Bukan di Lubnan, saya tahu Bukit Beru belakang. Okay. Walaupun ejaannya ada khilaf sikit, Bayroute, tetap terimalah. Baik, terima kasih. So journaling sangat penting for me as a healthcare practitioner because I want to see the pattern of my clients' emotions, thoughts, behavior throughout the week, throughout the 2 weeks, throughout the month. Okay, because we need to see a pattern. Because for those yang terkena ataupun terlibat dalam otak effects ke apa kan, dia nak tengok tu lah. Dia nak tengok trend. Dia tak tengok harga sekarang, dia nak tengok trend. Okay, sebagai contoh, so it's the same thing. You want to see a trend, you want to see a pattern of those emotions. Okay, right. So I'm just going to check whether on Mentimeter there's any questions so far. Okay, pada question ke cadangan ke perkongsian pengalaman, I'll try to share it with the others. Okay, setakat ni no questions. Okay. Daripada Encik Haniki, ni Prof Haniki ni pencik ni. Oh, dia tak boleh masuk attendance. Okay, nanti kita akan hantar Prof, kita hantar link direct. Baik, insyaAllah. Okay, there's one comment on Mentimeter. Not feeling well, a bit annoyed with a colleague, but trying to calm myself down. Okay. Right. So these are the things that happen every day. I understand that. I feel sorry for your situation, but I do, you know, I'm happy to know that you're trying to calm yourself down. Okay. And if you need to learn or acquire any techniques, you can always contact us. It doesn't mean that you need to make an appointment at our clinic, but you can contact us and we can try to provide you the information in any way possible or easy for you to accept. Ada yang comment mixed feelings, I'm confused about my own feelings. Okay. I mean, a lot of people have that. They are confused about their own feelings. They have mixed feelings, and that's why we try to assist our clients of understanding what's happening, who they are, the emotions that they're going through. Okay. Thank you for that comment. The other one, the last one that I'm going to share here is, since I've been transferred here, I don't feel welcome at all, even on my first day here, and feel overwhelmed. I also tend to feel not happy doing my work now. How can I get over this feeling? Okay, right. Okay, so this is a question about adaptation. It's about question about adjustment. Okay, so I think you should reach out. You can always reach out to us dekat the unit, or you can later on email me and I'll try to see what we can provide you with. Okay, ada one more before I continue. What can we do if our colleagues seem not to be showing empathy? We can only learn empathy if we are aware that we lack it. But to highlight this to colleague would create tension between us. Okay, I will comment this somewhat towards the end. Okay, skip again. I'll comment this. Thank you for that. Okay, I'll just continue with the presentation. So we talk about emotions. We talk about understanding emotions and how to regulate emotions. Now, the other thing that we talk about would also be on building resilience. Resilience to apa? What is resilience? Resilience ni, in other words, is when you fall down. Okay, when you fall down, then you will be able to spring up again. Boleh melonjak balik. Maknanya tidak kekal di bawah. Jatuh, tapi bangun semula. Banyak lagu-lagu yang menceritakan tentang jatuh bangun semula. Kalau jatuh tak bangun-bangun, susah. Okay, right. So building resilience is about, number one is adaptability. Okay, adaptability. Macam tadi ada rakan-rakan kita yang kongsi tentang adaptability. Okay, adaptability, and also we talk about flexibility, responding to changes and challenges at the workplace. Okay, flexibility. Setengah orang dia rigid. Some people they're very rigid. Okay, so they need to give some leeway. They need to give some room towards the changes that are facing at the unit or department or the new workplace. Yang ni kita boleh bincang. Benda boleh bincang. So number one is adaptability. Number two is positive mindset. Okay. Positive mindset ni kadang-kadang a bit tricky to discuss. A bit tricky because there's something what we call, sebagai toxic positivity. Toxic positivity, I'm sure some of you pernah dengar. So sebagai contoh, benda buruk berlaku, bad things happen, but kau kena positif. Benda buruk berlaku, kau kena kuat. Benda buruk berlaku, kau kena, it's something, it's too toxic to that person. They can't be dealing with that day in, day out without doing any intervention about it. Okay, so sometimes I try to understand that from the patient's point of view, are they not positive in terms of mindset because of these factors? Okay, or are they just having a rigid mindset? The two things that I normally discuss with my clients is, when we talk about mindset, number one is growth mindset, a mind that will grow, and also we talk about fixed mindset, maknanya pemikiran yang dia tak nak ubah. Okay, so when I deal with patients who have fixed mindset, it's going to be a bit difficult because everything has to fit into their mindset, which is going to be difficult sometimes. But if they have growth mindset, then it's easier to work with. Okay, and also if we understand that in Islam, we always have to have a growth mindset. Bila mana kita dilanda dengan ujian, with calamities, with tribulations, say Alhamdulillah, thumma Alhamdulillah. Okay. I mean that there's something in for us. I'm not saying this to be taken generally. Okay, I'm not saying that nak kata semua yang melalui kesusahan ini perlu terimalah, hadaplah, jangan, don't complain. Tak, I'm not saying that. I'm just saying that to a certain degree we should see whether, God has something for us. But for what I understand, for myself, whatever that we receive, whatever that we go through in life, okay, whatever that we receive, whatever that we go through in life, whatever that has happened, we cannot change it. It has happened. It's qada. It has happened. Okay, but for things that has not happened yet, those are the things that we can work on. The qadarullah too. We can dua for our situation to change. And one of the things that we need to learn when we are faced with tribulations, calamities, or ujian yang kita menghadapi semua rintangan dan ujian ini, is to find what is the lesson behind it. There must be a lesson. Maknanya kalau kita bersedih sahaja, if we just want to feel sad, we will just want to feel angry, we will just want to feel upset, and we don't learn anything, then it's quite a loss. It's quite a loss. Okay, we need to see the lesson behind it, and of course, Allah knows best. Okay, Allah knows best. Tapi kadang-kadang this thing is a bit tricky to discuss dengan clients, sebab kadang-kadang they think that will be some form of toxic positivity, or doktor tak faham saya, easy for you to say, those kind of things. So we need to be very, very careful. We have patients who say that setiap kali kalau saya datang sini, or every time that I come here, all I get about spiritual advice is, kena solat lagi, kena solat, tambah solat, tingkatkan solat, tambah kuatkan lagi zikir, baca banyak Quran, read more Quran, do more zikir, do more solat prayers, and they say that I sometimes get fed up hearing that. They say that, bukan saya. They get fed up. And of course I want to know why do you feel that way? And of course they will say, as if what I'm doing right now is not enough. Macamlah apa yang saya buat ni sekarang tak cukup. We know that what we do can be better. We know that. Okay. And we look into Surah Al-Mulk, verse 2. Okay. Alladhi khalaqa mauta wal hayata liyabluwakum ayyukum ahsanu amala wa huwa azizul ghafur. Liyabluwakum, untuk menguji, to test, ayyukum, and amongst you, ahsanu amala, okay, is who is better in terms of amal or good deeds. So we are assisting clients to be better than before, but the way that we deliver it must be with empathy, must be wise. We don't say that, tak cukup tu, kena tambah lagi, tak. We don't say that. Okay? There are ways to deal with patients, and every patients are somewhat different. Okay? It's kind of challenging sometimes. Okay? So basically what we're trying to say, kita tak nak hashtag dan dakwah. Saya dah beritahu dah, dia tak nak buat. No, we don't do that. Nak dakwah, it has to be done in a certain manner, because the clients that we face sometimes, they are emotionally vulnerable in that sense. Okay? So positive mindset ni, we need to deliver, we need to inform, but how do we do that? Sometimes need certain skills, and you need to recognize or know the background of your client, then it will be much easier. Boleh, so number three, I see this a lot, perhaps lacking in some of my clients, which is problem solving skills. They come with a problem, but they don't have the skills to solve it. Okay. They come with a problem, and they don't have the skills to solve it. Tak ada salah siapa pun. Okay. Cuma sometimes it gets very tricky when they come with a problem, they don't want to know how to solve it. Okay. They don't want to know. Saya datang ni, saya nak cerita je. I just come here, I just want to talk. I don't think that I want to do that. Whatever that you suggested, I don't think I can do. Jadi it's a bit difficult lah. Okay. So as an individual, we must learn problem solving skills. Sounds easy, problem solving, but sometimes it's not. I share with some of my clients as well. I tell them that the problem that you have in life, in terms of emotions, in terms of thoughts, in terms of cognition, in terms of whatever it is, sometimes it's not so much different from problems yang mathematical problems. Kan, 2 tambah 2 berapa? 2 tolak 3 berapa? And I ask them to write their problems on a piece of paper. Why do I ask them to write the problems on a piece of paper? Because if you don't see your problem, then it's a little bit difficult to solve it. Kalau kira-kira 2 tambah 2, 4 tu memang senang. It's a simple problem. Tapi kalau mathematical problem yang agak kompleks, kalau you tak tulis, it's going to be difficult nak congak. It's a bit difficult to do it in your head, to do the calculation in your head. So the same thing, if you have a complex problem in life, dekat tempat kerja, dekat rumah, I would insist that you write it down so that we can see the problem and can see how it relates to each other and see what the solution is. And the other thing which is very, very important to me in terms of therapy, in terms of problem solving, is that everything has to be time sensitive. Time sensitive maksudnya ada timeline. When do we do this? What do we expect at this point of time? Give what's the duration that we're going to allow this to settle. It has to be time sensitive. Kalau tak, benda tak selesai, benda akan just keep dragging and dragging and dragging. Okay, boleh ya? So it's 8 minutes to 11. Okay, sikit lagi. So problem solving skill nombor 3. Nombor 4, seeking support. Seeking support is something which is huge to discuss. Yeah? Huge. Why do I say that? Because as far as my experience is concerned, most who come to seek support for the first time dekat klinik, the patients that I see, mungkin dah melalui, probably have gone through the problem for like more than 6 months, more than a year sometimes. Okay, 6 bulan lah dia sidai masalah tu, tersalai benda tu. Okay, and it doesn't change. Setahun, setahun setengah. There are a lot of things kenapa people don't come early. There are a lot of things. But once they come and they are able to see the problem and they're able to see the solution, a big number of them would say, why didn't I come earlier? Why didn't I come earlier? Why didn't I seek help earlier? And we ask the question. So may I know what was the factor that limited you or restrained you from coming earlier to seek professional help? Professional help, huh? Professional help. Entahlah, mak saya kata gini, bapak saya kata gini, suami saya tak bagi, macam-macam lah, all these kind of things, That is, those are the restrictions. And they will realize after a while that their own health is their own responsibility. They will realize that. So in other words, kalau kita ada masalah, seek professional help. Jangan seek help dekat, contoh dekat KRT, susah lah. Kan? Di KRT siapa nak tolong? KRT tahu ah? Kisah rumah tangga. Kisah rumah tangga. Sekarang dah banyak bentuk-bentuk KRT yang lain lah. Warga Kuantan lah, kisah dulu-dulu, macam-macam lah. People tend to like meluahkan perasaan di sana. They want to express themselves there, but you know that you won't get a reasonable amount of solution of effective solution. So get professional help. Boleh? Ada yang bertanya, I want to seek professional help, but I don't know how and where help. Okay. As for today, I can say that you can reach out to our unit, the Jabatan Psychiatry and Mental Health, SASMEC. You can reach out to our counselling unit, dekat OCD. Okay. Kalau you not anonymous, then you can perhaps email. Okay. Oh, sebab ni direct message ya. Okay. You can email lah. You can email. You can email me, then I'll try to see if I can help help you immediately or give you appointment. So, but reach out. But I think I have the responsibility to just email drfaiz@iiumlibrary.my, and I'll try to see what I can see what I can help you with. Okay, boleh? So the question was, I want to seek professional help. I don't know how and where. Okay, saya cuba bantu kat situ. Okay. Nombor 4 tadi seeking support. Nombor 5, self-reflection. Self-reflection ni susah. It's quite difficult. Self-reflection ni sometimes people rasa malu nak buat. They feel embarrassed. They don't want to know their real self. If that someone is a person who tends to be angry all the time, who tends to say bad things, who tends to treat other people not nice, who tends to gossip, so on and so forth. They don't want to know themselves. Dia pun malu nak tahu diri dia sendiri. Oh, aku ni orang yang suka mengumpat. Ya, contoh. Oh, aku ni sikit-sikit nak melenting. They don't want to know themselves. Or if people tell them that, you know what, you're a person who flips on small matters and you just go berserk sometimes, and they get angry knowing the truth. So self-reflection ni perlu ada humility, kena humble. Right? And we do encourage self-reflection. I understand that some clients who come to see us, they feel that I don't want to share my I. Okay? I don't want to share the bad qualities of myself. And I understand that some people have done things that they are so ashamed of and they don't want to share. It's fine. You don't want to share that, it's fine. But what we need to insist upon is that you think about it, and if it needs to be changed, it needs to be changed. Right? And if you need help in changing, we can always help. We can always help. Right? Kita ada barisan pakar-pakar kesihatan mental, dan juga ramailah, ramai. Bagus-bagus semuanya. Ni promosi sikit lah, promosi. Okay. Right. Self-reflection ni satu benda yang sensitive to some people. But when we do self-reflection kan, we are able to grow. We are able to grow. We are able to come better. Okay? We're able to learn from experiences. And we're able to build resilience because we are self-aware. Kita dah sedar diri. Oh, gini kan. So memandangkan ini, this is in conjunction with Ramadan kan, it's the best time to self-reflect. I'm saying this to myself, menasihati diri sendiri to self-reflect. Semoga ia istiqamah selepas Ramadan kan, sehingga ke Ramadan seterusnya jika diizinkan untuk bertemu dengan Ramadan seterusnya. Okay. One way of for myself kan, when we talk about self-reflection kan, which I share with clients, not all clients, some clients now, we ask kan, if this is your last day on earth, what do you want to do? Who do you want to become? Last day. Of course, you want to be the best version of yourself. And the best version doesn't mean the most hardworking, the most compassionate. The best version is someone who has a deep degree of humility. Sedar diri. Itu yang they would somewhat realize. Okay? So if we live our day as though tomorrow is our death, then it's going to be different. It's going to be different. Okay. Right, it's 11 o'clock. I'm just going to mention a bit of stress management. Sikit je lah. Stress management ni tajuk yang very generic. Tapi I just mention and I'll give you the slides later. Ada slides. Okay. Stress management. I'm just going to mention this in subtitle. Stress management, number one is time management. Okay, pengurusan masa. Number two is setting boundaries. Setting boundaries. Oh, this one is huge. Setting boundaries. I'll petik lebih sikit nanti. I'll expand that a bit. Mindfulness practices, social support, number four, and healthy lifestyle. Okay, time management, setting boundaries, mindful practices, social support, healthy lifestyle. Okay. Time management, kebanyakan daripada kita termasuk saya memang ke laut lah. Memang difficult lah in terms of time management. So kita sentiasa mendoakan, we always pray to God. Bukan kita sampai jam 12. Kena scam lagi saya hari ni. Dah aku 12, insyaAllah boleh. Baik, apa tadi? Time management. Okay, time management ke laut. Okay, time management, we always have to pray to God untuk memberikan, to grant us barakah in our life, and dalam hal ini khusus untuk time, khusus untuk masa. We are given 24 hours a day, we know. Tetapi we see other people seolah-olah they have more time than other people. And one factor might be because of barakah. Ada barakah di dalam time dia itu, di dalam rezekinya itu, okay, di dalam kehidupannya itu. Dan we ask for barakah. Dan barakah ini benda yang kita tak nak ukur. So, but as far we can do time management is prioritization and delegation, reduce stress, and also to enhance productivity. And delegation ni sometimes people have problems delegating dia punya task. So dia nak buat ataupun dia tak nak buat tapi dia rasa dia kena buat, right? So delegation penting. Prioritization, right? Kita pernah tengok the quadrant. Important, urgent. Not important, not urgent. Very important, very urgent. Those kind of things. Kita pernah tengok that ni. We'll probably kupas in some other time. Okay, time management. Then you also have setting boundaries. Okay, setting boundaries. Setting boundaries ni sangat-sangat diperlukan oleh kebanyakan yang bekerja ataupun yang di rumah jugalah, tapi khusus untuk orang bekerja. Sebab setting boundaries, some people they cannot say no. Boleh tak? Boleh. Kan? Belum tanya lagi, boleh. They cannot say no. They cannot say no is one thing, and the other thing is they are a people pleaser. People pleaser. Dia nak please other people. Ada penyakit ni, betul? Bukanlah penyakit dalam buku tu, tidaklah. They cannot, they just want to please people lah. At their own expense. Please people tak salah, but not at your own expense. Maknanya orang bagi kerja semua buat sebab takut menyinggung perasaan orang lain walaupun dirinya terbakar ataupun penat, lelah. So they must set boundaries. They must know how to say no. Okay. Saying no is not something bad. Okay. Saying no is not something bad. Awak boleh tak awak buat kerja ni? Minta maaf lah saya ni. Macam tu. Boleh, tak ada masalah. Tapi janganlah kita tahu kita pernah jumpa orang yang cakap no sepanjang masa. Kita tahu. Okay. But I'm saying that for us, if we are not able to do it, then we must learn how to say no. We must learn how to set boundaries. Okay. So that's one thing. Mindfulness practices, I think we mentioned earlier on tadi. I'm not going to elaborate on that. Social support, stress management termasuk juga, social support juga termasuk dalam stress management. In what way? You have to seek social support from friends, family or colleagues, okay, to cope with stress. Macam nak cope with stress and to gain different perspectives. Untuk mendapatkan pendapat yang lain, untuk mendapatkan sudut pandang yang berbeza. Okay, sebab kadang-kadang we only have tunnel vision at that point of time. We don't see the options that we have. So we share with our colleagues, with our healthcare providers, with our family, so that, actually, you can do like this one, I didn't see that, thank you. Right? But sometimes when we seek social support, kita hanya seek social support untuk orang mendengar sahaja. We only seek social support to offload our emotional burden. Sometimes it's not fair. Sometimes it's not fair to our spouse, to our partner, to our friends, to our colleagues, to whoever it is that receives that emotional burden. Kan tak fair kan? Because we just want to offload it. Rasa lega lah cerita dengan awak. Itu je. Kesian kawan kena dengar kan? Right? Because I keep telling people, clients, myself, the one resource that we cannot produce is time. Is time. Masa tu tidak boleh dihasilkan. Kita tak boleh hasilkan masa. Okay. So when we talk to people or we do things, kan, that time has gone, it cannot be retrieved balik. Tak ada. Okay. So kadang-kadang memang ada kita panggil caregiver burden. Caregiver burden maknanya suami ke isteri yang kena dengar masalah anak dia ke, suami ke isteri dia ke. Ada dengar, tapi tidak ada perubahan berlaku. Okay. That time spent on just listening without any specific problem solving strategy or intervention is lost and it cannot be regained, and it is satu kerugian. Okay. So I always advise my clients. I tell them, some of my clients, not everyone. I tell them, if you present me with 10 problems for today, I would like to see at least 3 or 4 solutions. You boleh cerita masalah, boleh. Tapi I would like to see 3 or 4 solutions from you. Okay, and then the next follow-up, we will see whether you have executed those strategies. Contohnya lah, bukanlah semua orang, kadang-kadang sebahagiannya. Okay. Okay, so we need to be aware of that, realistic of that. The number 5 is healthy lifestyle, regular exercise, balanced nutrition, sufficient sleep. Kan? Sufficient sleep ni saya tak boleh nak cerita panjang lah sebab saya pun tak apa nak tidur bagus sangat. Okay. Bukan sebab tahajud, sebab tak tahulah apa. Ya. InsyaAllah lah. Tapi pada those who are not able to sleep, who have insomnia, please get help. Ramai orang ada insomnia dan lambat mendapatkan rawatan. Okay. It just disrupts their work, their personal life, you know. So if you do have insomnia, get help. Get assessment and then get help. Balanced nutrition. This one is also a very difficult topic to discuss. Because from our culture, our dietary intake is mainly, I think, is about carbs lah kan. Simple carbs. Gula, gula sedap. Gula, nasi, lagi, pulut, apa lagi? Apa lagi ya? Santan. Kan? It's mainly that. Kalau pergi buka puasa ada roti je, roti kering kan, tak nak. Kambing nak lah. Tapi sayur kurang makan. Kacang kurang makan. Okay. So there are studies done when they look into dietary habits, nutrition, they can relate it somewhat to mental health status. Okay. So we need to be mindful of what we eat. Okay. All right. I'm just gonna see whether there's any update on the Mentimeter. Okay, I'm just going to read a few comments and questions boleh ya. So nanti saya sambung sikit lagi of the slides that I have. Okay. Not feeling well, hati asyik teringat anak sakit mulut, ada ulcer, susah makan minum. Okay, syafa'Allah. Syafa'Allah, semoga anak sihat. Ya. And of course, bila anak tidak sihat, it will affect dia punya performance at work. And for those colleagues who can empathize, they will assist this person with work ataupun duties lah, that would be good. Okay, tapi kadang kena bagi tahu lah. Please don't say my name. I feel frustrated at work. Okay, but I don't see your name. So, okay, soalan doktor, bagaimana mau deal dengan orang yang tidak dapat menerima trauma orang lain? How to deal with other people who cannot accept the trauma of others? Kerana dia sentiasa menyebut setiap orang ada childhood trauma, because he or she always mentions that everyone has childhood trauma. Tapi dah besar, pandai-pandailah handle, jangan effect orang lain. But when translation is bad, but when you already grow, when you are already an adult, pandai-pandailah handle. You have to be able to handle it. Jangan effect orang lain. Don't affect others. Wow. That's something difficult to just cover in this short hours, kan? Again, I'll come back to it in a while, okay? Because I'm going to relate it to workplace. Okay, workplace. What if we already say no, however, we are faced to do it through blackmail? For example, if you don't do it, your APA will be low. Ada APA is APAR. Okay, APA. Wow. Okay. I see that this is skewing towards burnout at the workplace, which I will cover in a while later. Okay. Thank you for the questions. I really appreciate it. You know, it's anonymous. Again, I'm going to mention it's anonymous. Just send it, and we'll try to do something about it. All right. Okay. Okay. Sikit lagi before I go into burnout. Suka betul cerita burnout kan? Tak tahu kenapa. I'll tell you why. I'll tell you why nanti. I'll tell you why. So dia sejam lagi ya. Harapnya extension masa tu is the last extension lah. Pukul 12. Tahu dah buat saya okey je. Ada klinik je lepas ni. Okay. I'm just going to cover just few bit communication lah. Communication, then we tend to that burnout thingy. Communication skills. Okay, communication skills. This is again another huge topic. Active listening. Active listening. Study ada contoh that just now there was a example that maybe listening was not there. Awak ada child trauma, awak deal lah sendiri. But the person doesn't want to understand what that individual is going through or has gone through. Mendengar ni adalah satu skill. Active listening is a skill. It can be learned. Boleh dipelajari. When we have good levels of active listening, we will be able to improve our understanding about the situation. We will be able to improve our understanding about others. We're able to empathize more, and we would be able to have effective communication in the workplace or at home. Okay. And we must be honest with ourselves. Skill-skill yang kita sebutkan daripada awal tadi sampai sekarang, especially communication skills, emotional regulation. When we think about it, when was the time that we were taught about this? Bila kali terakhir yang kita telah diajar perkara ini? Emosi, komunikasi, bila? Adakah di tadika? Is it in preschool? Is it in sekolah rendah? Is it in sekolah menengah? Is it in, matriculations or pra-U or university, or is it at the workplace? Real sessions, learning on communication skills and emotional regulation. Ada tak? As far as my experience is concerned, I would say no. Adalah mungkin waktu lunch ada talk on communication skills 1 jam. Mungkin ada. Okay. But as we know it, saya bagi contoh. Sebab bulan Ramadan, saya bagi contoh lah. Al-Quran. Okay. Nombor 1, kita dengar. Kan? We listen to it. Okay. Nombor 2, kita baca, we read. We listen, we read. Nombor 3, we reflect. We reflect upon it. Apa maksud ayat ni? What's the meaning of this ayat? How relevant it is to me? And number 4, we apply it. Right? Listen, read, reflect, apply. Sama lah kalau buat study, when we do studies, KAP, knowledge, attitude and practice. Knowledge, attitude, practice. Okay. So my point here is that, have we learned about communication skills? Have we learned about emotional regulation? Even as we work nowadays. Because kalau tak belajar anywhere, we won't learn. There are no formal classes done. We have to learn it as we go on. I'm not saying that the organization that you work in is responsible to provide that, but if they do, then it is a bonus. Okay. And not just learn, it's reflecting upon that and later on applying it. Okay. We see if we read through the Quran and we reflect, and then when we apply the things that are contained, the contents of the Quran, then most of what goes on in our life would not be existing anymore. Tak ada orang yang maki-maki, there will be no people lashing bad words or doing evil things, so on and so forth, because they have the Quran in their daily life. Okay, they understand what it means and they reflect upon it and they practice it. Okay, ini nasihat untuk diri saya sendiri lah, orang yang tolong dengar je lah. Okay, so in other words, the reflection part and the application part is something that we want to see. We know that we have to be good to others. We know that we have to speak nicely to others, but sometimes we don't know how to practice it. We don't have the support. Why? Because the environment that we are in does not support that. The environment that we're in does not support saying things in a good manner. The environment that we're in does not support people who are berkelakuan baik, sebagai contoh. The environment that we're in is a dog eat dog world. Okay. Dog eat dog ni maksudnya pandai-pandai hidup lah, sebagai contoh. Right? That's the environment that we're in. Okay. So when we talk about active listening, coming back to active listening, bila masa yang kita pelajari macam mana nak mendengar dengan baik? There was once I went for a training elsewhere lah, not here, and we were teaching on how to help customers ataupun clients, and the part that was given was about communication lah, basically communication. Ada unsur-unsur motivational interviewing skills, right? So there was one comment from the participant. The participants are all healthcare providers. And what he or she said was that, kenapa nak belajar semua ni? Kita bukan nak jadi counselor. I'm like, okay. It was somewhat young. Okay. I see where you're coming from, and I respect your views. You know, it's something that we need to reflect on. Berkata baik ini bukan khusus pada counselor atau healthcare provider saja. It's for everybody. It's for everybody, and that is what we need to understand. Okay. Listening skills is for everybody. Ia bukan hanya kepada ketua-ketua unit dan sebagainya. It's for everybody. Okay. But when do we learn that? If people are from, macam tadi, just to relate to traumatic childhood kan. If people come from a traumatic environment when they were a child, and they did not have the opportunity to be exposed to all these positive things such as communication skills, you know, emotional regulation, of course their life when they're adult is going to be a little bit, you know, difficult for them. All right, and it's something real. It is not benda yang dibuat-buat. It's not something that people make up. Oh, I had a bad childhood, and therefore I'm just sad. You know, it's real. Of course, some people will say, aku pun dulu teruk juga masa budak, okay je. You know, again. Dalam bilik yang sejuknya 22 darjah Celsius, ada yang pakai baju tebal, ada yang menggigil, ada sejuk ketor, ya. Ada yang pakai singlet, singlet tak pakai singlet, ya, tapi dia boleh berpakaian singlet kalau dia nak. So everybody will respond to the environment differently. We cannot just make a blanket statement. Ini saya punya point. Okay, boleh? Baik, harapnya ni. Kalau nak komen je tak apa. Kalau nak cakap seorang-seorang ni bahaya juga. Assertive communication, under communication skill, assertive communication, assertiveness. Pun saya talk about a lot about assertiveness. Assertiveness ni is in between aggressiveness and passivity, atau passiveness, if that's a word. Sure there is. Assertive saya selalu beri contoh. I always give example of stewardess ataupun stewards. Naik kapal terbang ada cabin crew lah, basically. Cabin crew. When we are seated and the airplane is about to take off, then kita tak pakai tali pinggang. We don't fasten our seat belts. We don't, you know, put the tray back into its place. And the steward come to us and say, "Excuse me, sir. Excuse me, madam. We are taking off. Please, you know, put your seat upright and also stow away the tray into its place." Kan? Naik kursi sikit, lepas tu simpan balik meja tu. Okay? Nanti say that. Kita tak buat. Kali kedua dia datang. The second time they come. And they say the same thing, but full of assertiveness. Dia tak marah. They are not angry with you. And they are also not afraid of you. Dia sebagai contoh, dia tak kata when they are angry, they don't say, "Madam, Mister, I already told you, you don't listen ke?" Right? Just put your seat upright lah. What's so difficult about it? They don't say that. And on the other hand, they don't do it passively. They don't say, "Minta maaf lah makcik, encik, cik. Minta maaf cik, tolong angkat kursi boleh tak? Saya takut nanti saya kena marah dengan saya punya ketua steward hari ni." They don't say that as well. But they will say it again.
Boleh tak?
"Excuse me, sir. Excuse me, madam. Can you please put your seat upright and have and stow away the table?" Itu je, assertive. Dan di tempat kerja, at workplace, we need to learn to be assertive. Kan? Ramai orang yang dipijak. A lot of people at the work has been trampled over, dibully because they are not assertive. Okay. Bukan salah dia lah, tapi sebab skill tu dia tak belajar lagi. But I understand. If you have the skills but you don't have the support, it's also going to be difficult. And so what I say to my clients, I say, you need to be assertive at the workplace. This is what you need to do. And if you come across any problems at your workplace, you let me know. Then I would have to, find some way to intervene or to inform your department or your workplace that, they cannot do these things to you. Okay, saya bagi that support. We have to give that support. Tak boleh cakap je. Okay, we have to give that support. Boleh faham So we teach skills, we share knowledge, and we provide the support. Okay, kita tak nak just ajar lepas tu tak apa, pandai-pandai awak lah buat, bukan urusan saya dah. I mean that's not going to work. We have to give support. That's my opinion lah, and my way of doing things. Okay, meaning you empower the patient. So it's assertive communication. Assertive communication ni kena ada, and it would also be related to setting boundaries tadi. When you are assertive, you're able to set boundaries. If you are not assertive, you don't have boundaries, you cannot say no, and then kerja you bertimbun lah. Right? And then you blame yourself. So you can see that cycle. Ni contoh je lah. Conflict resolution, another thing. Especially at the workplace, conflict resolution. How to resolve conflict? There are ways to resolve conflict. There are many steps, there are many styles. Okay. And also we would like to teach those things. So cerita banyak pasal workplace ni kan, sebab tempat cari makan. Kalau konflik dekat pasar Ramadan tak pergi. Tempat kerja dia sensitif sikit. Oh, baru saya tengok video itu tumbuk dekat pasar Ramadan kan. Macam-macam. Okay. So we talk about conflict resolutions. We want to resolve conflicts constructively. Secara positif, we want to resolve it constructively. We want to focus on mutual understanding. We want to compromise, and we want to find win-win situations. That's what we want to do. Tidak ada yang teraniaya, semua redha dengan keputusan. That's what we want to achieve. Okay. Sebab jika tidak ada conflict resolution, apa yang berlaku? What happens is that bilik pantry akan menjadi saksi. The pantry room will be the witness to gossiping. Tapi sekarang bilik pantry kosong sebab orang boleh gosip through WhatsApp lah, Telegram dan sebagainya. So that's another thing lah. So what I'm trying to say is that conflict resolution has to be bersemuka, duduk depan-depan, right? Find a mutual understanding, compromise, find win-win situations. That's what we're going to do, conflict resolution. Tapi we understand that most people that we try to deal with, dia takut nak jumpa bersemuka. They're afraid. For whatever reason, I don't know. Mungkin sebab salah satu parti sangat bengis, very, very hostile, or very, very reserved ataupun avoidant in that nature. Okay, so all these things we must understand. So you can see now that at the workplace specifically, secara khususnya, is very, very dynamic. It's not straightforward. We must understand that. And I should mention here that the people, the experts who deal with this are organizational psychologists. You can Google that, organizational psychologists. They are the experts in dealing with these kind of things. Okay, their patient is the organization. Organisasi itu pesakit dia. Jadi untuk kami di psychiatry, psychology counselor, our patients are individuals, not organizations. Okay, clear? Feedback, communication skill, giving feedback. Emphasize the importance of giving feedback and receiving feedback openly and constructively. Okay. Bagi feedback ni kadang-kadang saya tahu setengah orang dia tak pandai nak bagi feedback. For example lah, I can't remember right now. But basically it's like macam, hey, you very bad at this thing lah. You should do this, you should do this. The way that they give feedback to is not constructive. I don't like you lah. Ada kan? Saya tak suka awak. Ada feedback macam tu. I mean, it's not constructive. Ada feedback which is not given openly. In front of us, senyum-senyum. Okay, alright, okay. Belakang, bila buat report, when they do the report, oi, lain macam. Okay. Depan senyum, belakang, lain macam report dia. In front, they are quite nice, but the report they write is not nice. So they're not open about giving feedback. So these are the things that we need to discuss. Non-verbal communication. Ini kan jeling mata gitu. Gitu. Dia jelingnya tu. Muncul mulut. Okay, non-verbal communication. It happens. Okay. So all these things, when we talk about communication skills, there's one huge topic that I sometimes talk about is called incivility at the workplace ataupun ketidaktamadunan di tempat kerja. Right? Ketidaktamadunan di tempat kerja. Maknanya semua orang buat suka hati dia je. Nak marah dia marah je kan. Dia cakap dia pun nak cakap. Sebab apa? Sebab apa dia cakap macam tu? Sebab boleh kan. Sebab boleh. Budak sekarang kan semua boleh kan. Pandai orang. Okay. Sebenarnya tak boleh. Dia je kata boleh. Right. Okay. So saya rest setengah minit sekejap. But let it sink in sekejap. Sink in. Buat bulan puasa ni kena bersabar sikit. Banyak orang turun ni. Petik je workplace burnout, banyak turun. Okay. Saya bacakan dekat Mentimeter. Dr. Faiz, some bosses are so slow. Bawa kereta so slow. Dan tak habis. And not giving out clear instruction. Some bosses so slow and not giving out clear instruction. Making us feel like we're doing it wrong. Even not talking to us in professional manner. Too emotional, anger out to us. Yeah. I hear you. And I have patients that have the same complaint. Saya tak tahu hari ni nak cover tajuk ni ke tidak. Sebab tengah setengah jam lagi. Saya cubalah. Yeah. Nanti saya akan sum up in 10 minutes time lagi. Good point. Assalamualaikum warahmatullahi wabarakatuh. Waalaikumsalam. How to deal with a bossy boss? Dah boss-bossy ya. Bagus. Kalau staff bawah kena follow rules, tapi dia boleh je tak follow rules. Contoh, kena tulis nama pada log sheet bila keluar tapi dia tak tulis pun. Sebab apa? Sebab boleh. Itulah masalah, sebab boleh. Jangan. I have marriage issues. Somehow I just choose to forget about what's going on at home and try to distract myself with tight schedule at work. Hope to deal with things later. Is that normal? It's not normal. Situasi bias oleh superior berlaku apabila subordinate itu adalah kawan kita sendiri. Perkara ini menimbulkan konflik di tempat kerja dan ada yang pihak kolik lain menanggung stres itu. Komen doktor. Okey, baik. Nanti saya kumpulkan semua komen. Bagus soalan ni. Dan last sekali. Falling sick in the month of Ramadan really tests your iman and your body. With so much at work pending, deadlines to be met, money to seek for financial commitments for raya. Okay. I empathize. Okay, so listening to all this sharing daripada rakan sekerja from all our colleagues, apparently this topic is under burnout at the workplace. So saya cuba sum up in 20 minutes time. What I tell clients, burnout ini tanda-tanda atau gejala-gejala, the symptoms are emotional symptoms. Ada yang depressed, ada yang anxious, ada yang tak tidur, ada yang letih dan sebagainya. And when we look into the symptoms, when you isi DAS, DASS, when you isi PHQ questionnaires, when you see all these tools yang kita pernah isi, that we have filled up throughout our tenure in this organization, kita pernah isi at one point in our life. Okay, and then they will reveal whether we are depressed, anxious, or stressed. Kan? Fair enough, right? And then when you are anxious, depressed, or stressed, you'll be referred to counseling, psychology, atau psychiatry. Basically mental health unit lah. And then when you go there, ni cerita secara am lah, bukan semestinya berlaku 100%. This overall. And then when you gather the courage to go to see that mental health care practitioner, then they will say that you are going through an episode of depression, they're going through a episode of anxiety, and most likely you have major depressive disorder, so on and so forth, and you will be given some other ubat, pharmacotherapy, ataupun you be given psychotherapy. But sadly, the stressor ataupun the punca kuasa atau the punca to your emotions is something to do with the workplace. Yang tadi semua kita bacakan tadi. So my question is that major depressive disorder? Daripada segi simptom, yes, it qualifies. Cumanya pendapat saya lah. Jika simptom ini berlaku, if these symptoms occur ataupun exist in a person who is employed, a person who is working, and it is somewhat related to the workplace, then to me, it is burnout at the workplace until proven otherwise. Right? It's burnout at the workplace. Then people will ask, apakah itu burnout at the workplace? Jadi mereka bertanya. In short, burnout at the workplace ini orang dah lama dah kaji. People have studied this since the 70s. Cuma it hasn't been into arus perdana, at least in Malaysia setting. However, good news, however, in 2019, masa sebelum COVID 2019, WHO, World Health Organization, has, I would just say, use the word certified, has certified that burnout is a syndrome that can be included in the ICD, the latest one, version 11, International Classification of Disease. So makna kata burnout ini ada di dalam kitab tersebut. Kalau kita sakit pneumonia, sakit kencing manis, sakit whatever it is, ada coding dia dalam ICD 11. Now the latest is 11. So burnout at the workplace is in ICD 11 with the code QD85. QD85, you can check. QD85 is that. Okay. Is that. Mengapa perkara ini penting untuk saya sampaikan pada hari ini? Salah satunya because one of it is because people are talking about all these emotions that they have at the workplace and related to the workplace. It is important for me to identify whether this is burnout at the workplace and not major depressive disorder because it has an impact on treatment, on prognosis, on progress. So just imagine that this person is having problems at work, whether it's because of the boss, whether because of colleague, whether because of workload, whatever it is. And I just give medication, I just give psychotherapy without intervening with the stressor at hand. Is the person going to get well? Most do get well. Kebanyakan akan sembuh. How? Tukar department, tukar unit, tukar organisation, berhenti kerja, niaga, jadi dropship. They get well because they are no longer exposed to the stress at work. But is that how we want to deal with things? Right. So maknanya, in other words, we're saying that burnout at the workplace is something which we can diagnose and we can treat, and there are ways to treat it. And one of it, the main major thing is to intervene at the workplace. Intervene ni bukan maksudnya pergi tangkap bos dia, tidak. Tak ada siapa yang kena tangkap, tak ada siapa yang kena buang kerja. I keep telling this over and over again. No. Intervention, dia ada step-step dia yang perlu dilakukan. Okay. IIM doesn't allow to tukar campus. Tak boleh tukar, jangan tukar. To me personally, when people tukar unit, tukar department, tukar campus, tukar tempat kerja, berhenti kerja, when it is not their entire fault, it is to me akin, seumpama suicide, career suicide lah basically, you know, and suicide is a sad thing. So is this career suicide couple girl? It's sad. It needs to be intervened, and the intervention tak susah pun. The intervention tak susah. Penerimaan dia might be susah. The acceptance of that intervention might be difficult, but the intervention is not difficult. Intervention dia seperti apa? Review balik workload, work pace, review balik job description, review balik communication skills at the workplace, you know. And most of the time, you know, people can contribute to a change at the workplace. Boleh. And if you ask me, you know, being a Muslim, Islam has provided us with that guideline to treat others well. And why don't we treat others well? You know, adakah masalah hati, spirit, jiwa? If yes, then the person who needs to be treated is not just that individual, but the individual or individuals who are creating that environment in the first place. If you ask me, yeah. So macam mana? Apa cerita? Yeah. Apa cerita? Right. Okay. Having said that, when I said tadi tu jumpa psychiatrist, jumpa saya, kalau saya diagnose sebagai major depressive disorder, which is a primary psychiatric disorder, primary psychiatric illness, it is not fair. You know, it is not fair because most people, you know, they don't want to be diagnosed with a mental health condition. Kan? Kalau boleh lah, kalau boleh. Saya pun sama. I have the same view. If possible, I don't want to diagnose you with any primary psychiatric disorders, major depressive disorder, because if it is burnout is not a primary psychiatric disorder. Burnout is not a primary psychiatric disorder. It is not. So for those people who are feeling sad, who are feeling upset, who are feeling depressed, who are feeling worthless, guilt dan sebagainya at the workplace, you are not depressed in that sense of MDD. Tak. You're having burnout. And the treatment has to be done, has to be delivered at the workplace. Okay? So dalam erti kata lain pendek, in short, awak bukan psychiatric. Ni orang layman cakap lah, saya bukan psychiatric. Okay, fine, I'll use that same term lah. You know, although I don't quite fully agree, but anyway. And to a little bit more harsh things that people say, which I'm not fond of, is like when they say, saya bukan gila. Gila tu means having mental health conditions. No, you're not. You're just having burnout at the workplace. You're not whatever that you say that you're not. Bukan. You tak gila. Betul. Saya setuju. Okay. So the impact on the patient is different. Right? So you don't have any primary psychiatric disorder, you have burnout at the workplace, we have to intervene. So the next question will be, how do I go about with that intervention? Macam mana nak intervene? Saya takut dengan bos saya. Saya punya organisation tak bagi komplain-komplain. Okay? Untuk pengetahuan tuan-tuan dan puan-puan, pada semua orang yang employed, yang bekerja, kita berada di bawah payung Occupational Safety and Health, the Department of Occupational Safety and Health. Dia ada akta dia. Ada akta pekerjaan. There's a work act, Employment Act. Ada Jabatan Tenaga Kerja. Semua ini ada undang-undang dia. Ada peraturannya. And from a recent meeting with several parties, DOSH, basically, they are coming out with a guideline on psychosocial risk factors. Okay. Guideline tu belum ada, but they are working on it, which is good. And I think by this year will come out. Okay. Psychosocial risk factors, how to deal with psychosocial risk factors. Macam tadi lah, all these are psychosocial risk factors. Colleagues, bosses, workload, time, dan sebagainya. All these are psychosocial risk factors. What's this guideline about? Because when we work, there are risk factors that we are exposed to at work. Number 1 is ergonomics. Number 2 is chemical. Number 3 is noise. Number 4 is musculoskeletal, so on and so forth. Banyak lah. Okay? Those have guidelines. Maknanya for those who bagi contoh kerja dengan radiology department kan. Radiology department dia ada guideline untuk health dia. Dia tak boleh be exposed. They cannot be exposed too much to radiation. The world there that blue tag. Kalau blue tag tu is a certain number, a certain reading is too much. They say that radiation is too much. Then dia diberi cuti. Automatic. Apart from the cuti of 14 days per year tu, radiation leave. But unfortunately, we don't have a tag that we can wear to read on the stress levels that we're facing at work. Tak ada. Unfortunately, tak ada. And as far as I can say for now, tidak akan ada. For now, tak ada. Okay. Tag tu tak ada lah. Tetapi, how to monitor or show that the trend of stress tu ada, itu ada. Questionnaires. Speaking up. Documenting things. Right? Itu ada. So communication is key. Sebab some bosses, they don't know that they are causing you stress. Dia orang tak tahu. Sejujurnya dia tak tahu. We have to bersangka baik. So it is our duty to say, excuse me sir, excuse me madam, may I inform you that your way of communication is causing stress on me. Your harsh words is causing stress on me and it's affecting my work. We have to learn to say that. So that your boss can see, oh, sorry, I didn't know. I will change my way of talking to you. Kan? Nampak macam fantasi kan? Until we try, we must say that. So what happens kalau bos kata, oh ya ke? Nasi awak lah, saya boleh? Tu cerita dia lain lah. It's a different story. The different story in the sense that those things can be notified to DOSH. Ada borang dia, there's a form to isi, but not you isi, doktor yang kena isi. The doctor will fill up that form. It's JKKP7. The form number is JKKP7. Jabatan Keselamatan dan Kesihatan Pekerjaan. Number 7 is in E form. E means electronic. So in other words, the client will come and see me and they say I got stress at work and it's related to work, and I listen for a few sessions and I think, yeah, it is burnout at the workplace. Then I just need to fill in that form and then shoot it to Putrajaya, and then they will come and do the assessment lah. Okay. So ada, jalannya ada. And nobody will get hurt in terms of remuneration ke kenaikan pangkat. Tak, it's not even related to that. The intervention will be in terms of recommendation. Okay, janganlah nak marah orang macam ni. Bagilah masa dia untuk sembuh daripada penyakit dia. Contoh. Contohlah. Right? Ada yang sebut they label you with having mental problem if you question the boss. Okay, ini to me is fikrah lama. It's yang lama, yang to me is outdated. People cannot say those kind of things. It's outdated. I'll give you an example lah. It's a bit sensitive, but I'll give you an example. Zaman dulu, those days, I can't remember how long it was. Those days, it was normal for female workers to be harassed sexually by male workers, especially kalau male workers to boss. It was normal. It was normal. And there was no undang-undang, there was no regulation, there was no Akta Act, there was nothing to protect women from being harassed sexually by male counterparts. Tak ada. Saya tak tahu nak bagi contoh sebab tak harass kan. Tapi orang cerita kat saya, orang cerita. Contohnya, I apa? Nak pun nama apa? Nama apa contoh nama? Contoh nama perempuan. Ayu. Nampak seksi je hari ni. Contoh. Awak jangan saya ni. That is a form of sexual harassment. Kita rasa gurau. We think it's like banter at the workplace kan. But if the lady, the worker, the female worker feels that she is not safe or feels that it is emotionally affecting her, she can report as sexual harassment and terus jadi kes jenayah. dia tak lalu dah dodge tadi ni pada pandangan saya, tak lalu dah. It becomes case polis ke apa. Sebab dah akta, direct akta. So now people are protected from this sexual harassment. So my point is that nowadays we want also to be protected from all this emotional aggression from other people. I keep telling my clients, I tell them, I know that the emotional aggression cannot be seen, the psychological stress ataupun the psychological attack cannot be seen. I know that. Everybody knows that. But it can be reported, it can be notified. I don't want you to go to work getting this thing every day, kena marah, kena maki, kena pulau dan sebagainya. You can report that and we can help you with that. It's seolah-olah, it's like going to work and the people in your office are just smoking away, menghembus udara yang penuh dengan, all these harmful chemicals. And I tell them, you want to go to work in that kind of environment? Do you know that the law is protecting you, the act? Because if you look into the act, the Employment Act, is that the majikan, the employer, has to provide perlu just paraphrasing, perlu memastikan keselamatan dan kesihatan dan juga kebajikan, the safety, the health and also the welfare of the pekerja. So adakah menerima makian secara harian itu satu benda yang sihat, satu benda well-being? No. So there is points to make notification. Boleh faham? So kita ada lagi 12 minit. Doktor, ada audience tanya what about the adult mild autism? Oh, jauh lari. Okay, I don't know the angle of the question. Can you elaborate a bit? Boleh? Sebab saya tak faham sangat dia punya ni. Boleh ya, so setakat ni boleh ya. So saya minta maaf, saya kongsikan perkara yang mungkin menyinggung sesetengah pihak. Tidak, itu bukan tujuannya. Tujuan untuk menyedarkan bahawa dalam Islam sendiri kita tidak boleh hidup dalam suasana yang negatif. Untuk kita beramal dan beribadah kepada Tuhan ini, kita perlu dalam keadaan yang tenang. Jadi jika ada pihak-pihak yang tidak memberikan ketenangan, maka kita boleh menyuarakannya mengikut saluran yang telah disediakan. Bukan suka-suka hati membuat surat layang ataupun aduan-aduan yang tidak berasaskan akal. It still has to go through a specific pathway, and I provide that pathway. Okay, saya bukan promosi, saya hanya bagi tahu, saya tanggung saya untuk bagi tahu yang saya banyak menguruskan kes-kes burnout di workplace ini, sama ada daripada institusi kerajaan maupun swasta. Okay, so that's what we need to do. We need to create that awareness that orang tidak boleh buat sesuka hati. Dia ada undang-undang dia. I keep telling clients who are going through burnout, I said, antara budaya dan peraturan kerja are two different things. And what needs to be prioritized is peraturan kerja. Saya bagi contoh, I'll give you example. Sebab ada client share dengan saya, the client share with me. Doctor, if we are MC, we still have to work. I said, why do you still have to work if you're an MC? Oh no, it's how we do, it's how things are done in my organization. And I say, you know what? Budaya kerja dengan peraturan kerja menurut DOJ, it's different. It's different. Kita kena mengutamakan peraturan kerja, DOJ. If you're an MC and you're not well, then you MC lah. Kenapa nak kena kerja? Tapi, ada tapi lah. Tapi itu yang kita nak kena change balik dia punya mindset. Because I will ask you today, majikan mana yang akan memaksa pekerja dia bekerja when he or she is on MC? Majikan mana? Majikan mana? Ada majikan boleh angkat tangan. Tak, kami dekat tempat kerja kami memang kalau MC kerja je. Tak ada. So jangan angkat budaya itu terlampau tinggi sehingga takut untuk go against it. Budaya yang baik kita terima. Budaya songsang kita tak terima. Maksudnya kira pada saya budaya songsang lah kan. Contohlah. Tapi of course, this is not a subject to be simply uncovered in 1 or 2 hours. It needs long discussion. But the message that I want to deliver is that kita perlu aware of our mental health. Kita perlu aware of the provisions that we have by law or by acts or by undang-undang pekerjaan, and we need to exercise that if it is indicated. Janganlah terseksa seorang diri. Janganlah takut untuk membuat tindakan ataupun mengambil langkah seterusnya. Jangan risau. Jangan risau. Ada benda kita boleh bincang. Okay? Saya ambil satu soalan, co-worker sebar fitnah macam mana nak buat? Perlu sabar atau report polis? Okay. Of course you need to see the form of fitnah, tapi kalau dalam Jabatan Kesihatan Pekerjaan ni dia kita boleh buat notifikasi, but okay, good question. Kita boleh buat notifikasi. What we need usually, this is how I do things. We need the 5W. 5W. Who, what, where, when, witness. So sebagai contoh ni, siapa yang sebar fitnah, apa yang dia cakap, bila dia buat benda ni, kat mana dan bila, dan ada tak saksi. So you ambil 5 perkara ini, you tulis dalam you punya nota, tapi you have to email yourself. Email diri sendiri. Sebab apa email diri sendiri? Sebab kita nak timestamp tu. Kita nak timestamp. Timestamp kan dalam email ada timestamp kan? We want that timestamp. Alright? Sebab kalau tulis dalam buku nota, simpan setahun, lepas tu baru nak tunjuk, orang akan kata ni semalam awak tertidur, awak tulis ni. Kan? Jadi cerita tu pula. Tapi kalau you write things, setiap kali berlaku fitnah, you tulis and you email yourself kan. So that pattern can be seen over that 1 year course. Alright? But to me, if you kena fitnah, you have to, macam saya kata tadi, conflict resolution. You have to communicate that person. Minta maaf, Encik, kabarnya ada berita yang tidak betul tepat tentang saya. Kan? Betul ke? Berjumpa bersemuka, bawa witness orang. Bermakna benda boleh settle dekat unit atau department. Kalau dia lari, atau kalau dia berdalih, then escalate to the next level. Okay? Boleh? Admin perlu isi evaluation form ni. Evaluation form apa ni? Bukan. Okay, sorry. Oh, untuk city the point. Okay, tu tak berkenaan. Okay. Baik, so to wrap up, ada 6 minit lagi dan saya perlu menyambung tugas hakiki. Saya ucap terima kasih kepada yang bertanya soalan, kepada yang berkongsi. Saya akan cuba jawab satu persatu dan saya tak tahu nak share kat mana nanti. Kat mana nak share? Soalan tu memang saya akan macam soalan tadi tu, marriage issues kan, benda ni semua real. Tak apa, nanti macam mana nak buat? Nak share kat mana? Tapi kalau dia nak anonymous? Ya. Okey, tak apa, macam ni. Saya email saya Dr. Faiz at iium.edu, don't mind. Those yang tanya soalan tadi, they can email me, but I will not reveal your identity. Saya ni jujur orangnya, insyaAllah. Okay. Tapi kalau you still nak anonymous, nanti saya rasa saya akan umumkan satu portal untuk retrieve that information lah. Okay, but I take those questions seriously, and ada jalan keluarnya insyaAllah. Okay, ada jalan untuk mengurangkan impak daripada mental health kita, physical health kita. Alright. Saya mengucapkan terima kasih kepada pihak library department yang telah sudi mengundang saya. Tajuk roller coaster, tiba-tiba lain pula jadinya. Jadi bumper car. Tapi alhamdulillah, kita nak menyentuh isu-isu yang relevan kepada komuniti kita. Kita tidak hanya mau cerita isu-isu yang hanya menjadi halwa telinga saja. InsyaAllah, bagus. Ini satu platform yang bagus. Saya minta maaf jika apa yang saya cakap itu menyinggung perasaan. Saya minta maaf jika apa yang saya cakap tidak tepat. Boleh tegur saya, boleh maklumkan kepada saya jika ada updates. Apa yang saya cakap ini kebanyakan adalah pendapat peribadi yang berdasarkan kepada pengalaman sendiri dan beberapa rujukan-rujukan yang mungkin saya tidak sertakan di sini, tapi at any time boleh bertanya dengan saya, tak ada masalah. Dan saya mengucapkan selamat berpuasa kepada seluruh warga IIUM. Semoga puasa kali ini memberikan kelainan pada iman kita, pada diri kita, dan semoga kita semua beroleh keampunan dari Allah Azza wa Jalla dalam suratul Hadid ayat 21 jika tidak silap. Auzubillahi minasyaitonirrajim. Sabiqu ila maghfiratin rabbukum. Sabiqu, berlumba-lumbalah ila kepada maghfiratin, keampunan Tuhanmu, rabbukum, wa jannati, dan juga syurganya. Jadi kita semua nak berlumba untuk mencapai keampunan Allah Azza wa Jalla. Kita nak berlumba untuk itu. Jangan nak lumba benda lain, lumbalah. Tetapi jangan lupa perlumbaan untuk mencari keampunan Allah Azza wa Jalla. Dengan demikian saya mengucapkan terima kasih sekali lagi dan mengakhiri penyampaian saya ini dengan wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh. Assalamualaikum.
Jazakallahu khairan katsira, Dr. Faiz, for your enlightening talk. Ladies and gentlemen, let's take a moment to reflect on the valuable insight shared by Dr. Faiz, especially as we observe the blessed month of Ramadan. A gentle reminder, for those who still did not log in, attend or fill up evaluation form, you may do so by clicking the link provided in the chat box. Okay, we have now reached the end of the session. On behalf of the al-Hikmah library, we would like to express our sincere gratitude to Dr. Faiz bin Tahir for his invaluable contribution. Your wisdom has truly touched our heart and minds, guiding us to navigate life's challenge with strength and positivity. Thank you to all the respected audience members for the participation and for joining us today. We wish you all a best Ramadan. With that, wabillahi taufiq wal hidayah. Assalamualaikum warahmatullahi wabarakatuh.